Welcome to the second module, Risk Adjustment Payer Perspective, from Chapter 1 of Unit 1. This course has been designed to be a review course to help prepare you to take the CRC, the Certified Risk Coder Certification exam from the OPC. Hello everyone. I am Emily Taylor, the Chief Medical Coding Instructor. I am glad to welcome you to the world of medical coding. This module series is designed to guide you in your quest to become a certified risk adjustment coder and help you get a firm knowledge of how things work in the U.S. healthcare industry. In the first module, we discussed coding profession and defined the role of a risk adjustment coder. In this module, we will state the impact of risk adjustment, explain the opportunities and challenges in risk adjustment, then describe the role of a risk adjustment coder, and finally discuss record retrieval and record review process. The objective of risk adjustment program is to make insurance available to all individuals, regardless of risk, and to allow plans that insure less healthier population than average, to charge similar average premiums as plans that insure relatively healthy populations. The risk adjustment model presented under the Affordable Care Act is budget neutral. ACA has created stable risk adjustment program for the commercial population to transfer funds from lower risk plans to higher risk plans in the individual and small markets. Members' risk adjustment factor scores are considered to decide whether a plan will receive funds or pay funds. Risk adjustment for Medicaid population differs from state to state. Although it has some similarities to the Medicare and commercial programs, there are many differences that plans must consider as the Medicaid program expands. Those who receive care under Medicare Part B may enroll in any Medicare Advantage plan that is offered for the district in which they live. Medicare Advantage plans are managed by Medicare Advantage organizations. The MA plans offer additional benefits, lower premiums, or both. Plans must accept all enrollees and submit bids to CMS annually to outline their additional benefits, cost-sharing rules, provider networks, and premiums. These factors are specific to each plan and are estimates of the expected cost of offering a benefits package to the average member. Click the term to learn about managed care organizations. The need for certified professional coders grew as diagnosis coding gained more importance. Vendor partners' services were required for chart review, record retrieval, record review, and data submission. When a plan collects the most exact diagnosis codes for its members, it is permitted to use that information not only to cover claims cost, but to implement a vigorous care management plan. That plan will ensure its members are being provided with the tools, education, and resources to ensure that diseases are prevented, controlled, and foreseen prior to its appearance or complications. The short timelines to gather and submit the data to cover claims costs becomes a challenge for payers. Hence, careful planning and execution is essential to ensure record retrieval, coding, and accurate submission of data. Sometimes, members may not seek preventive care services as recommended, or may visit specialists and care centers only when need arises. This builds an incomplete diagnostic profile of the member. Therefore, plans must keep on involving their members to visit a primary care physician to keep an eye on their medical needs. Risk-adjusted codes must be accurately submitted by providers, at least once annually, to CMS. But the challenge is getting the accurate code at the time of diagnosis and ensuring that the patient seeks care for the diagnosis. Of late, EMRs are taking note of the importance of these risk-adjusted diagnosis codes and are providing tools that highlight HCC codes for easy identification. Hence, the need arises to educate provider to capture the complete diagnostic profile of a member. The growing need for certified coders in risk adjustment has led to numerous risk adjustment roles. A certified coder can assist the risk adjustment department's management team with devising department policies and procedures that comply with accepted guidelines and are in line with the goals of the health plan.
What are the distinct features of a certified professional coder?
Certified professional coders can accurately extract the most specific diagnosis codes from the medical documentation and help to recover appropriate funds to the health plan. They identify an overcoded chart, and help to lessen a plan's risk adjustment data validation, RADV, audit risk. Risk mitigation is important to a plan's risk adjustment efforts because the threat of a RADV audit failure and the associated cause of errors, if any found, threaten a plan's financial success.
Can you explain this further?
Highly audited areas for risk adjustment are cancer, strokes, fractures, and acute myocardial infarctions. A certified coder on the payer's team can identify these codes so that they can be submitted as a deletion file to CMS. This will result in the diagnosis being deleted from the member's and plan's risk profile, as needed. This helps to mitigate the cause of RADV risk. A payer could request charts from a provider either for post-payment review, to investigate special cases, or for healthcare effectiveness data and information set. Such requests for record retrieval can disrupt provider workflow.
What's the best way to retrieve information without disturbing provider work process?
The most non-interfering method in which a payer can retrieve the records would be through provider's permission to remotely access the health plan's electronic medical records. In this way, only few selected employees of the health plan access the records of a predetermined list of risk-adjusted patients for review. This process requires signing strict security and contractual agreements to protect patient privacy under HIPAA, Health Insurance Portability and Accountability Act of 1996 regulations. Once the process is in place, the selected employees of the health plan are allowed to access only the records they need from their secured site, without disturbing the workflow of the provider's office or their staff.
What if a provider denies access?
In case access is not granted, an employee or vendor of the health plan must visit the office and retrieve the records. However, this requires scheduling a time slot for the employee to access the system and print or download only the appropriate and necessary records of that health plan for review. Hence, professionalism, positive attitude, strong interpersonal skills, punctuality, ability to maintain secrecy, and organization skills are key attributes that a record retrieval specialist must have.
What if a provider denies access?
Record review is done to extract the severity of illness in patients when there are shortcomings in diagnostic coding. Often, this information is documented in the chart but not represented in the diagnosis code submitted on the claim. So, when a certified professional coder reviews the records, it allows health plans to correctly reveal the severity of a patient's illness and get paid the applicable amount to adequately cover claims costs. This kind of work increases the need for certified coders trained in risk adjustment coding. Other than capturing the severity of illness, chart review provides a health plan with an opportunity to identify prospects for provider education, such as documentation deficiencies. These educational opportunities can enhance accuracy in coding, which would in turn reduce the need for costly chart retrieval and review efforts. This brings us to the end of Module 2 from Chapter 1 of Unit 1. In this module, we first analyze the impact of risk adjustment, then explain the opportunities and challenges in risk adjustment, later describe the role of risk adjustment coder, and finally discussed record retrieval and record review process.